Hi, everybody. Just want to give you a heads up here at the top of the episode that this will contain discussions of self-harm and suicidal ideation. Wow, grip it and rip it.
I'm like totally ready for this episode.
I'm coursing with adrenaline.
I know. I feel like
Look at my hands. Look at them shaking.
I've been ready to talk about this episode.
Well, let's stop wasting time.
Yes. Hello, everyone, and
Hi.
welcome. Welcome to Purple Friends.
Yeah.
I'm your co-host, Joe.
And I'm your Joe host, Co.
That was the best.
You like that?
Yeah, that was good. And today we're talking about it, you guys. We're talking about IFS.
IFS. We've talked about it a little bit in like most of our episodes, I feel like.
Probably every single one. It is a mode of therapy that I tend to use a lot. But it is also somewhat new to me. You know, I didn't learn this in grad school. I learned it post-grad.
Did we say? Internal Family Systems is what
Yes.
IFS stands for. We are talking about internal family systems today, and we're going to talk about why it's called internal family systems, the history of it, how it's used today. You're going to love it. But first, we have to do something called Little Gratefuls.
Yeah, you did it.
I did it. I remembered.
Yeah, you remembered. And I did too, just right now that I opened this page.
Mm-hmm.
But yes, Little Gratefuls. I actually have not thought about this.
Me either.
Until
I'm
this
like
very
a deer
moment.
in the headlights right now. I have one. I can go.
Go ahead.
Okay. Boy, what part of this? You're dying over there. Okay.
Usually I come somewhat prepared.
Yeah, I know,
thought
me
about
too.
this
I usually have
somewhat.
written something
Yes.
down next to Little Gratefuls, the big note on our notes.
But you
that
know
says
what?
Little
This
Gratefuls.
is what we expect our audience to do.
Exactly.
We should be able to do this. Come up with something on the spot.
Exactly. And I'm going to do that right now. I'm very grateful for the Office YouTube channel.
Oh my goodness.
That has
Yeah.
posted so many high quality clips of some of my favorite scenes from that show that I am then able to illegally take from the internet using a YouTube to MP3 converter and use to make fun music.
It is seriously fun music.
I'm
It's
glad
like,
you like it.
it's like my kind of, like, are you kidding me? Office quotes, but now I can just sing them. Like, I don't know. Not in like a weird, like musical-y way, but like
Yeah.
in like a, I don't know. I'm excited. I love
That's
I
high
love
praise.
this new album that you're working on.
Really appreciate that. I don't normally get that reaction because normally I produce only instrumental music. So I feel like you especially are like, there are words for me to sing along to, so I'm into it.
Yes, I'm much more visually inclined versus auditorially inclined. So yeah, I don't notice all the nuances with the instrumentals. We're like, I know lyrics. That's like words.
You know when something slaps.
Yeah. My Little Grateful actually is my journal, which is here.
Oh, nice.
Right? But then it made me think of the new mini palettes I've recently got.
Oh,
and
yes.
how much more watercolor painting I've been doing, both in my journal and just for funsies. And I'm really grateful for those little guys.
Yes,
They're like
so-
seriously so little and so adorable, and I can't get enough of them.
Yeah, a mini palette, like an artist palette.
Yeah.
How many are we talking?
How many?
I'm sorry, how many
Oh, how
are we
many?
talking?
I'm like, I only got 2. And there's, they're like 2 inches by 2 inches or 2 by 1 inch.
The whole thing, like the paint wells and the
mixing tray. Yeah. If we know anything about watercolors, then you know what I'm talking about. But they're freaking adorable, and they're so like thoughtfully made. I love to just like play with the actual like paint palette, which is
they're very
because they're like they have
satisfying.
magnets on them and they click real satisfyingly.
Yeah.
So if you're a client, you've maybe noticed me playing or messing around with them.
Yeah, it's kind of like a fidget toy.
It's a lot like a fidget toy, and I think about that when I'm in session. That I'm like, this is a fidget toy. But I'm really grateful for them. They're adorable, and I love them.
Yeah.
Shall we get into it?
Let's get into this.
Okay, I'm taking a big old breath because I'm probably gonna get into the meat and potatoes right away, you know?
Have we ever mentioned that? Okay, let's talk about your teaching credentials really quick. You've taught at the university level. You've taught at the high school level as a substitute, a long-term substitute, and your students, well, maybe I shouldn't brag on that because this is a public place, but your students did very well on the AP Psych exam. So well that you got an award. This woman knows how to teach about psychology is what I'm trying to tell you.
Thank you so much for that intro. I feel like the Bulls music was playing in the background.
I can do that. I can make that in there.
Do it.
Alan Parsons Project, you will be receiving a call from me.
But anyway, let's get into it. Internal family systems is a model of psychotherapy, and it's comprised essentially of parts, right? This idea that our psyche, our identity is, divided into these parts of ourselves. And honestly, this is a very common vernacular. Like I hear this colloquially all the time of people being like, well, a part of me felt angry, but I was fine.
Yes.
Or like, I don't know, there's like a part of me that cares and then a part of me that doesn't. But anyway, so it's very intuitive is what I've seen, is that like to introduce it to clients, it's actually very easy. And because we're getting to know both the client and parts of the client, I have found it to be very like integrative to my practice. And it just made sense once I learned about it, which is why I've started to really implement it. But the idea behind IFS is that we are, everyone has a core self, and we'll talk about different qualities of the core self and how to identify the core self. And the goal is to integrate all these parts into the core self, right? Have it be part of the system. So ideally, this example would be like a people-pleasing part. We talked about this last week. And this part of us is kind of essentially born out of experience, right? We've maybe felt at one point we needed to people please in order to feel loved, to be accepted, to whatever else, right? And so that part eventually needs to get integrated into the system. The healing needs to begin. We need to understand where they're coming from, what they want, what do they want us to know, what do we want them to know, so that it's not working against us, and that essentially the core self is making the decisions and driving the bus is what I like to say. Right.
And something that is pretty central to IFS is that yourself, the concept of yourself, is inherently wise, compassionate, and capable of healing. So there are no lost causes in IFS.
Yes, we don't want to get rid of any of these parts. I think that's a very common misconception, is that like, well, this part of me sucks. I want to get rid of it. Like it's not helping me. It came out of trauma and we need to ignore it or, eradicate it. That's totally not the case. In fact, the opposite.
In fact, the book that I'm going to be talking about later that was written by the founder of this therapy mode is, the name of the book is No Bad Parts, and that's central to the idea of IFS.
Right. We want to embrace these parts of us because they are us, right? And so let's talk a little bit about the self, right? Because it all kind of goes back to the self. The self is, we like to call it the 8 C's and the 5 P's, just to kind of help.
Whoa, who is we?
Dr. Fatter, who is, just another educator in the world of psychology.
Oh, cool.
And she is a big proponent of IFS.
Oh,
and
cool. Okay. This
is just one of the new, the mnemonic devices that we can help ourselves and our clients identify what the core self is, what does it feel like, when are we operating from them, and essentially this is a good way to remember that, right? So the 8 C's are curiosity, calm, compassion, courage, creativity, connectedness, clarity, and confidence.
Whoa, that's a lot of C's.
Yeah,
actually.
There's 8 of them.
I can't believe none of them was Corey.
Maybe for you, it'll be 9 C's.
Yeah.
And then 5 P's: presence, perspective, persistence, playfulness, and patience. So if you are ever, and the example I give is like, if you're an artist or you're creating something or whatever else, you make something, and you initially feel curious and calm, and you feel playful, and you feel patient, and you feel confident and creative, like chances are you're operating from your core self. You're doing something that genuinely feels good. It's like flourishing from like your soul, right? That flow state.
Yeah, you're flowing. That's exactly what I was thinking.
So generally speaking, that is like your core self. But then we have other parts of us that come in, right? Like another common part is like the inner critic.
Yeah. I mean, some of us have those real loud.
Very loud, nonstop, constantly in the driver's seat.
Where my mom's at. You got those? Any moms out there?
Lots of moms, honestly, like just so many, lots of women.
Yeah.
Even men. I don't know what I'm talking about. I feel like so many people struggle with that inner critic, like of just like everyone is their own worst critic. And the critic we're going to start to learn is plays a role. The inner critic plays a role.
Right.
I would call that a manager part.
Yes.
And so let's get into the types of roles that these parts can take.
Yes. So you said manager part.
Yes. There are essentially three.
Yeah, there's three.
Three parts. Exiles,
Yep.
which are the parts of us that hold all the pain and the burden. So the parts of us that have been abused and been hurt and been lied to and betrayed and experience a lot of pain, and going there is painful and we try to avoid it, right? Those are the exiles.
Yeah.
We're essentially
literally exiled them from ourself.
From our consciousness, from ourselves. Then we have our protector parts, which include managers and firefighters.
Yes.
So these protector parts are essentially trying to protect the self, right? Like they're part of the system. You know, they're constantly at play. They have the self's best interest in mind, but sometimes they can be a little misguided. Manager parts, when they're burdened, meaning they're stressed out, will start to take...
Anxiety.
Yes.
Over preparedness.
Yes.
To a dangerous level, a self-harming level sometimes.
Correct. So like something like people pleasing is a manager part. The self-critic is a manager part. I have more examples here.
While you're looking for that, I just want to clarify. Earlier we talked about like your inner critic part, whatever. The parts that we're talking about now, exiles, managers, and firefighters, these are the three main types of parts in IFS. And when we talk about like your inner critic or like whatever else you want to name, any part that you're working through with yourself, that's like your own personal part that you get to name. And you can assign it to one of these three categories.
Yeah, these are just common parts.
Firefighters.
Yes, like right. This is just a good way of us understanding how they show up, where they're coming from, what they're doing,
and kind of like what their goals are, even if they seem like they're hurting you.
Right. So like, again, a perfectionist part. That's a manager part, right?
Yep.
Being a perfectionist, wanting everything to be perfect. We want that because maybe at some point in our life, something wasn't perfect and we felt like that was the crux of this whole situation. And so now this part of us anxiously wants perfection. And even if we know it's not serving us, we still engage in that behavior. And so, yes, that is a burdened part, right? A burdened protective part, a burdened manager part. Now, when they're unburdened, they serve the system very well.
Yeah, managers and firefighters like when are good. Those are normal good things.
Needed. Like I often say, like we need to please other people sometimes. We need to know how to multitask and how to be dedicated and adaptive. You know, like these are good qualities that come with these parts. It's only when they're burdened. It's only when they're
in overdrive.
Because there's fear around the exile coming into consciousness, right? So like you said, manager parts are more preemptive attempts.
Yeah, the way that I was thinking about it is managers are more proactive and firefighters are more reactive.
Correct. So let's talk a little bit about firefighter parts. So firefighter parts are another protective part. So again, their intention is to protect the self. Yeah. And that comes after the exile has come into the consciousness, right?
It can sometimes be pretty extreme.
Very extreme, right? Like there's this idea of like at all costs, right?
Like self-harm is a firefighter part.
Yeah, suicidal ideation is a firefighter part. Yes, so substance use can also be a common firefighter part. And the idea is that like at all costs, right? They want to remove the pain, right? They want to take out the fire. At all costs. So just like firefighters, they're putting out the fire at all costs, at the cost of the damage of the house, the damage of the ground. Like what the fire is the main priority. So if it's ever burdened enough, it can take on these extremes, right? It can be very reactive and rageful. There can be some dissociation, a lot of dissociation I see sometimes as being a fight or flight part. But again, like fight or flight parts, when they're unburdened, can be useful for the system.
Yeah, you might be thinking all those things as you mentioned, how could they possibly be useful?
Well, they maintain balance, right? They allow us to relax. They shut down a little bit, right? Like it allows us to be present, right? So like if we're not dissociative, we're present. If we're not trying to numb our pain, we're experiencing it. And we might be able to regulate enough to where we can actually relax without the need of aids, right? So it is a balance, right? And being aware of like, how do they play out? What triggers them? When do these parts of me show up? And how am I better equipped at just knowing how to get back into that core self driver's seat,
right.
you know?
Firefighter parts. The thing that I keep thinking is like, I'm just thinking about self-harm, right? Like this firefighter part. When that's like not at that extreme, self-harm, it doesn't look like self-harm. That's what I wanted to get across is like this part in balance doesn't look the same as it does when it's out of balance.
Yeah. That's a good point.
Just because like that was something that I had an issue with in understanding, especially when I was reading the book that I'm going to talk about later. Just the idea of no bad parts. And I'm sure that there's some people out there who are also have gone through traumatic experiences who are like, I can think of some bad parts. And I just wanted to clarify that for people. This is not about minimizing that trauma. To clarify, like, I just want people to understand when we say there are no bad parts, we're not trying to say like that these parts in their extremes aren't like harming you or causing trauma. What we're saying is like that is a part of you that has good intentions, but is like completely out of whack and is hurting you instead.
Yes. Because, okay, let's break that down. The part of us that engages in self-harm only wants our best interest in mind.
To alleviate something.
Yes. And that might not make sense to a lot of people who haven't experienced that, right? Like when you're thinking about harming yourself, it's not because you want to cause yourself harm or that you want to hurt yourself or end your life. It's that you want to live your life. You want to feel something. You want desperately like, or distract yourself from this other thing that you're feeling, like focusing on this pain that's very tangible, that's very, yes, tangible. Grounding. Yeah. Yes, absolutely. That feeling has often been described as numbing because then it shifts into this more dissociative state and can be very calming. And so that part of us that is doing that is just desperately wanting to live, right? Wanting better for us. And we might not have any other options in that point. And that's the point, right? Is that we want to catch that part up. You know, we want to tell them we do have options though. Maybe at one point we didn't, and this was our only option.
Yeah, maybe when we were a kid
or
and in a past relationship, but
absolutely,
it's not like that anymore.
Where we don't have resources, and now we do. You know, and we can engage in those, and we can tell that part that actually the self is here and hears you, and you are safe here, and we can go at your pace.
And I don't need you to take care of me anymore. I'm going to take care of you now. And
that conversation is so powerful when it started, like the conversation between yourself to part. Because what tends to happen is like a power struggle, part to part power struggle. Who's driving the bus, this part or that part? And when we start to have a self to part conversation, it shifts the power dynamic completely, where it's like, none of you guys have power. I'm the one in control, or I'm the one who has the power here. But we really appreciate and are grateful for these parts because at the end of the day, they are us.
Yes.
And so going back to that part of us that maybe didn't have the option, right? We want to show that part a lot of grace.
Yes.
A lot of patience and kindness and empathy. Forgiveness. Because they didn't have another choice. We can't fault them for that.
Yeah.
They are trying their best. Yeah. You know, when we're operating from that place, we are just trying our best. And so I hold a lot of space for that. and I notice this too. I've noticed in sessions, I might be one of the only or some of the first people to like give that part space for my clients. And then it like I said, it's such an intuitive work that like that clicks, right? There's a release, a relief, of like unburdening that part, right? The exile becoming unburdened and being integrated into the system, right? It can be really relieving. It's not this thing that we fear anymore. It's this thing that we approach, that we use, that we engage with, like I think about people who have experienced lots of trauma and yet have used that to like open organizations or have talks or, help other people or use their experience to reach others or,
help prevent others from going through the same thing.
Whatever else, or make art or have deeper relationships, be present parents. Whatever that impact is, it's very real. So that in a nutshell, big nutshell is IFS. And so that is the perspective I tend to use with clients.
So that's a lot to digest, but that's sort of like the foundation that you need to like continue.
Engage with the rest of this episode. Yeah.
Now, if you're like me, when you first heard about this, you were probably like, what do you mean you're going to talk to other parts of me? Are you saying the thing that comes to my mind is what used to be called multiple personality disorder, which is now called dissociative identity disorder. Sort of like what you see dramatized in movies on TV all the time.
Yeah.
Speaking to different parts of you that have like totally different consciousnesses
and names and mannerisms.
Identities.
Yep.
Yes. It's not that.
Well,
but it is
kind of
have a little bit of that in it.
So,
which is,
I would say yes, it is that. I would say it is that the extreme version. Because the more complex the system, the more trauma the person has endured. Sure. Right. So the more trauma you have, chances are the more complex the system is, the more dissociative, the more volatile these parts can be. And in some cases that does develop into DID. And something I want to say too is that IFS is probably one of the less pathological approaches. So we're not viewing in terms of, we're not viewing in terms of diagnosing, right? It's not the point of like finding symptoms and matching them to a certain diagnosis.
Right.
And treating them appropriately. It's more of this approach of like everyone experiences these different parts and these different roles. And it's just about the extremities or how they impact you personally and creating that system that works for you and yourself, So it's not quite DID.
But if that helps you visualize it.
I mean, I do use that sometimes with clients. Like,
yeah, but you also need to understand that this is not like, I don't know how to say this. Like, it's not out of the client's control, right? Like, they're consciously choosing to engage with another part. This is not like what you see in movies where people are like taken over by another personality.
No,
it is nothing like, because so when we said like, it is kind of like that, it's not actually like that in that way.
In that way, no.
Yes.
Thank you for clarifying. No, It is not like that in that way. But I do have like pseudo conversations with those parts of clients or parts of myself.
And that is part of it. I mean, that's specifically a big part of IFS.
Like I'll often encourage clients to name their anxiety. And like we talked about this earlier, like I've named mine Jerry.
Jerry, yes. People names, like a human name.
And I just think I'm like, Jerry's so annoying. Like he's shown up again. And
that's my dad's name.
I know. I'm so sorry.
Dear departed dad.
I'm so sorry. I feel like because I never had knew him.
Yeah.
Like
there's Jerry. It's different.
To me, Jerry is still like one of those names.
It's available.
Right. Like, exactly. It's available. It's up for grabs.
Yeah.
So I grabbed it several years ago. Jerry's not new.
No, Jerry been here.
Yeah, Jerry been here. But yeah, it kind of helps me.
Sorry, Jerry?
Yeah.
Wow. Yep. Same.
But anyway, Jerry helps me separate my core self from that part of myself. part of me is anxious, not all of me.
Mm-hmm.
You know, part of me is feeling this. Other parts of me can engage in other ways, right? So separating it and creating that distance, that unblending, right? Because there's a lot of that too. There's this enmeshment between our parts of selves and us. Like I hear all the time, like, I'm such a people pleaser. Like this is who I am. I am this first and foremost. Or like we start to internalize that. Like this is, or another really good one that I see people internalize is like their attachment style. Attachment style changes across different relationships and time and situation. It's not that like, okay, if you are an anxious avoidant, like you show up in all relationships that way. No.
Yeah, that's wild. Like I've heard that. I've seen that like as in memes, people's Tinder profiles that say like,
I'm a
with your
this.
attachment style.
Yes.
Yeah.
And it's just like, no, part of you maybe felt that way in this particular situation, but let's not self-impose that. Like, let's not assume that that's how we're going to show up in every relationship, because we just don't know. So it helps unblending parts of us from the self. Right. And so if this self is coming from this, you know, like overflow of positive personal regard, like there's no room for for us to identify as these parts of us that like aren't us.
Is this also a cultural thing? Maybe like are some certainly people in some cultures are much more accepting of this idea of like being able to give voice and name to other aspects of themselves, so to speak. Maybe that's why, maybe this is, for me personally, I had a really hard time with that part of it. It's a lot of like, you have to buy into it.
A little bit.
Like you can kind of tell from the beginning, like if you get this, you get this. And if you don't, you don't.
If you've engaged with that part.
Yeah.
As I say it now.
Yeah.
But yeah, I know that there was like, not a necessary, like a intentional resistance, but just like a resistance there.
Yeah. It's very different from how I typically approach stuff. So
for me, it was like clicked right away.
Yeah.
Yeah. It made total sense. I got it completely immediately. I was like, yep.
Yeah.
This is my go-to now.
Yeah. So we really want to leave room for both types of people in our audience, because there's both types of people talking right now.
Absolutely. And we get along just fine.
Yeah.
Yeah. We make it work.
Yeah. Can I talk about the book that I read? Okay. So last episode, I read a book instead of doing a bunch of different research. I thought that was a lot of fun. I think I might try to do that as much as I can for each episode. For this episode, wait, were you going to say something?
I was just going to say, like, yeah, Corey consumes media auditorily. Like he's always got something in his ear. So like, a 6-hour book
for people who care.
Yeah,
I listen to it.
Yeah, I can't do that. So like, reading a book for me would take me a lot longer.
And if you couldn't tell by my tone, if you care about that, I don't care about your opinion. Audiobooks are a totally fine way to consume media.
Yes. Oh, absolutely. It doesn't. I mean, yeah, not cheating.
Yeah. I read a book.
Corey read a book.
The book that I read is actually like the book on this subject. I said earlier that it was 2017. I misspoke. It's 2013. The book is No Bad Parts by Richard Schwartz. And Richard Schwartz is sort of like he is the guy who made this up. The book is kind of interesting. It wasn't really what I was expecting. It's sort of, not just sort of, it is narrative. The core concept has like a ton of valuable insights about self-understanding, healing yourself, all stuff that we've talked about that can be really beneficial for stuff like this. The presentation is a lot like the mode of therapy itself. It's either you get it or you don't. That's how I would say the book is. The book is sort of like anecdotal case studies where Dr. Schwartz tries different things on his different clients, and they tell him what works and what doesn't. And he makes a ton of progress on the group of people that he works with. So the book is sort of arranged into these anecdotal case studies where Dr. Schwartz talks about his progress with a few of his patients or clients, I guess I should say. Well, they were patients, actually, because he was a psychiatrist doctor, as far as I know. And I shouldn't say was. He's still alive. It uses these anecdotal case studies to tell the the story of how he came to the understanding and the development of IFS. So it's a little experimental at first, but not in the way that you would expect from like scientific experimentation. It's just like, it's very narrative. It's about his personal narratives and the people that he worked with.
It's like a case study.
It is like a case study.
Yeah.
In fact, that's a good thing to say, because that's literally what it is. It's several case studies.
Yeah, it reminds me a lot of like when I used to read a lot of like Irving Yalom's books.
Yeah.
And like he would talk about his patients and like deep dive those and talk about his existential theories and stuff like that. Yeah.
Yalom.
Yeah, I used to talk a lot about Yalom.
It'd be really interesting to do an episode about like some
existentialism and making meaning. Yeah, I mean, that's very
foundational. We should do like a Psych 101 like series.
I love that.
We should do all of our planning for the podcast on the podcast in the middle of my book review.
This is now a podcast meeting.
Okay, so like I was saying,
case studies.
Yes. The book is very experiential. It's very about the perspective of Dr. Schwartz and the journey that he goes to develop the framework. So if you're listening to us describe this and you're thinking like, this sounds interesting, this sounds like something that I want to check out, you might really like this book. For me personally, and I know that there's some other people in our audience who are like this, I was expecting more of like a rigorous scientific, like, I guess what I was looking for was the story that comes after he develops it, where it's more like refining it, real like research studies rather than case studies with like qualitative and quantitative data, stuff like that. That comes after, and I don't want to make it sound like that doesn't exist.
Yeah.
So if you're interested in like the story and getting that good foundation and getting a really good, solid understanding of the framework and all those valuable insights that we talked about, this is a really good book for you, and I totally recommend it.
It can be a really nice way to like, especially if you're a reader and like maybe don't have a therapist that you're currently working with and are still interested in learning more about the topic. Yeah, so the book can be a really good place to start if you don't currently have a therapist and you're still like interested in learning more about it. Like that's a really good place to pick this conversation up.
Yeah. And I do want to give the caveat that
this is a way to do that.
Does veer a little towards like almost like the spiritual. So if that's something that you're not really comfortable with, I just want to give that sort of like trigger warning.
How so?
Well, in some ways,
because I have not read the book.
Yes, in some ways, some of the later experimentation with his clients feels like it's running into spiritual exorcism territory, sort of like, you know, in a way that it was a little.
I mean, you seem very off-putted.
Yeah, I want to be honest, like, and I want to give people a full like scope of what the book is like.
There is space here for that. I mean, full disclosure, just because I like IFS doesn't mean I use it for everyone, and like does not mean I expect people to like. I use other methods too.
Yeah. Well, I also want to say, like, just because I found that, and this happens a lot with like the father of X in psychology, where like they come up with something that's really interesting, and then like people expound on that and they expand on it, and it becomes a new, really cool thing. But the guy who invented it often spirals into some really strange stuff.
Like
sort
Freud
of think about Freud.
Yeah, Freud is a really good example where it's like, okay, you're onto something, but then you
let
get
him
weird.
talk for a little too long, and and that happens actually extraordinarily frequently in the history of psychology, and actually, I guess in the modern history of psychology too.
Which honestly makes perfect sense, right?
Yeah.
Like if we're talking about balance, even the world of psychology needs to be balanced, right? There's a lot of like really hard-hitting facts, and then there's like the weird parts of our mind. Like we've all been there. We've all been there.
Yep. So yeah, there are some people who I would recommend the book for. If you're a person like me, I don't think I would. There are other books. I wish that I had written them down. Probably. Oh, actually, I was recommended that the book by Dr. Schwartz following this book is much less narrative like this and much more like what I was describing when I wanted. I haven't checked that one out, but maybe there's a recommendation for somebody. Well, I can't because I got to read a book about the next thing now. So I think this is a really good place to like. Have you had any personal experiences where you have been able to like identify or noticed like two conflicting parts of yourself? Yeah, that's the thing is like you just have to think about a time when you felt like really conflicted. Like there's a part of you that feels this way and there's a part of you that feels this way. They're, of course, very personal.
Yeah. Well, I mean, and the thing, yeah. I mean, the thing is that, like, we might get into the habit, especially for, like, example, people pleasing, because we just did the episode on it. It's still fresh in my mind. Like, sometimes we might not always even recognize that we're feeling conflicted. It's just like second nature.
Yeah.
We step into this part of ourselves, and that's where we operate from.
And that, like, even in retrospect, it might not even feel like you were conflicted. It might feel like just that's how I do things. Like that's logically what I would do.
So like that's where that's like really blended, right? Earlier when I was talking. So yeah, that is part of my job, is like I do try to unblend that a little bit, right? Have people notice that, like, do you really want to be doing that, or is that just like first response? Yeah. So I guess if I were to ask you, like, have you ever felt that way? Like, it does mean being a little personal about it. I know I have definitely noticed different parts of myself, right? Or like the parts that chime in different parts of my life or different situations. Even as like the different roles that we play, like the part of me that comes out when I'm a therapist versus the part of me that comes out when I'm a mom.
Okay. I'm with you.
You know, there's a little bit of that in play too. Like, not that they don't intersect or interact with each other, but like there are parts of us that like engage differently in these different settings and like are triggered differently in these different ways, or like might feel safe in one arena of our life, but feel unstable and different. So all of that can be treated, quote unquote, using IFS.
Yeah. I feel like I have a firefighter part that tries to protect me from like social situations.
Yeah, probably.
And I don't know how much I should self-disclose, but there have been times when like my inability to handle a social situation has caused me to literally just shut down. Like, happens. And like that's sort of like, it feels like the firefighter part reacting to the manager part not doing enough. Like, let me give you an example. Like, let's say, this is going to reveal so much about my psyche. Let's say I'm talking to somebody on the phone, right? And I'm super nervous to talk to them on the phone. So I prepped, right? I told myself this is going to be anxious. This is going to be an anxious activity. So, you know, prep for that. Be aware that that's going to happen. Steel yourself. I do the phone call. Something happens that I wasn't expecting. Somebody asked me a question that I wasn't expecting. And everything goes out the window. And I'm panicking, like, got to get off the phone. And as soon as I'm done, I'm like, I can't believe I was so stupid. Like, that was so embarrassing. Like, I just beat the crap out of myself.
Yeah. I notice a lot of different parts there.
I don't do phone calls.
No, you don't. I asked you to do a phone call for me the other day, and you said nope.
Yeah, for work. You were like, could you call this person? And I was like,
said, nope. And I said, okay.
No, I feel very badly about that.
I hear a lot of parts in that statement, right? The part of you that avoids and then the part of you that criticize. There's two conflicting parts vying for power.
Totally.
And even being able to dissect that far and recognize that there's multiple parts to play, and that one statement, right, I think shows how hard it can be sometimes to identify your parts.
I mean, when I was saying that, I didn't expect there to be two parts.
There's even more, right? Your core self was also at play there.
Yeah. Hit.
So something that we can do to help us identify these parts and start to engage with this way of thinking or approaching ourselves is by just calling them out, right? Like noticing, okay, the example you gave with the phone is perfect.
Oh, good.
Because afterwards you're like, why, what happened, right? It's almost like you're playing catch up with yourself.
Yeah.
You don't even recognize yourself, right? That to me
I'm
is
annoyed with myself.
Yes, and you're annoyed with yourself. It's like you're having to clean up someone else's mess.
Yeah.
You're cleaning up your parts mess.
Yeah. the part that I so specifically prepared for.
Yeah. So yes, there's like that part, your manager part, your inner critic, feeling disappointed, your firefighter part, the avoidance, feeling triggered, and then yourself maybe feeling split, right?
At war with myself.
Yes, that's like the main crux of this, right? Is that part to part power struggle, and engaging that self to part conversation to redistribute that power.
Yeah. For yourself to step up and be like, actually, I'm the only one that gets to like talk.
Yeah.
And the rest of you can give suggestions.
And also, like, I'm in my living room. I am safe.
Yeah.
You know, like, I did prepare for this conversation. I know what I know. You know, I know what I'm here to say. Obviously, it's very hard in practice to like feel like step into that power and energy in the moment. But that is what we're working towards, right? Is identifying these getting better at identifying these different parts when they're triggered, how they show up. Like I said earlier, like what they want us to know, what we can let them know, you know, hearing their story, where are they operating from?
Okay, so
how old are they? Because that's a whole other thing that we did not even touch.
Yeah, is like compassion for these other parts, and like they have personality traits, like an age, like you said.
Yeah,
like the age that they were developed, basically.
Yes, there's this idea that parts are kind of frozen in time.
Yeah.
So if you developed this manager part when you were 10, it's frozen at 10 years old. Yeah. It doesn't know that you're this 30-something-year-old successful dude with a good relationship, a child.
You talking about me?
I'm talking about you. You know, like, there's a lot there that 10-year-old Corey does not know, and maybe we should catch him up on. Like, he doesn't have to count on himself anymore. He's got resources, and he's got lots of things going for him, you know? So it's just about catching that little boy up.
Catch that little boy up. Catch your little boys up.
You know, the common phrase, like, healing the inner child comes from IFS. You know, you are essentially healing that inner child.
Very in tune with IFS for sure.
Yeah, like this idea of even recognizing that there are parts of ourselves that are still stunted, and I shouldn't say that. It's not stunted. They're frozen. They're frozen in time.
They need your help.
They need our help. You know, they don't know any better. And it might take some time for them to fully understand this new world. And we be patient with them, and we teach them again and again and again until they get it. And that's what healing is, right? Like, there's this huge idea that, like, our firefighters especially are avoidant of pain, and avoiding pain, I think, is often called healing. Like,
or moving on or whatever.
Yeah, moving on, protecting my peace, setting certain boundaries, cutting off certain people. There's a lot of avoidance there, and I think it's been repackaged into healing. You know, we're just healing. I'm setting my boundaries. I'm getting rid of negative energy. To some degree, there's some validity there, but I do think oftentimes it's misrepresented, right? Especially in IFS, we have to go towards the pain in order to heal. We have to be able to have uncomfortable conversations both with our own self and with others in order for things to be better. You know, like having those conversations with our 10-year-old self and saying, yeah, we went through a lot of shit. You, a 10-year-old kid, went through a lot of shit. So yeah, even recognizing that this child, sometimes in session when we're having those conversations, that's the first time the client has ever even acknowledged that.
Yeah.
And recognize, like, oh, I was only 10, 5, 15, whatever.
Yeah.
And realizing I didn't know the stuff I know now.
Yeah.
I didn't have the resources. I didn't know. I was just trying my best. Like seeing those moments of like recognition and empathy really for your own self is really cool to watch.
Yeah. Very healing.
Yeah.
It's really important to show forgiveness to your past self, to especially your younger self. I mean, I know those are the same thing, but like, especially your young self. Because you were just doing the best you could. If you're anything like everybody else, you're just doing the best you could.
Yeah, and that counts for so much. And somehow we've said it's not enough.
Yeah.
You know?
And you might be the only person saying that. You probably are in a lot of these cases to yourself.
I hope I'm not.
No. No, not you specifically.
And I hope our audience is not the only person saying these things to themselves. You know,
well, that's what I'm saying. Like, people who are struggling with this, they might be.
Yeah. Yeah, it's true. You know, accessing, and that's another thing that we can talk about, this direct access, accessing those parts of us is really hard. Like I said, even acknowledging that a younger part of ourselves has had to endure any sort of trauma or pain, because we have a new perspective, especially as adults, as parents. You know, it hits a little different.
Yeah. There is life after mess ups.
Oh, for sure. You know, I see so many parents healing their inner child.
Yeah.
As they parent their children. Helping, identifying those parts can be really difficult. Journaling, of course, I'm a huge proponent and advocate for journaling.
Journaling, actually, speaking of that, that's much more accessible to me in this type of situation, this type of therapy, as like writing a letter to a part. And then reading it as that part. And then, that's a good way to, I think, a good entry point.
Because it's also you to you.
Yeah. And if you get, enough distance from it, maybe you could like read it with a different perspective than you wrote it.
Yeah. The reason why a lot of this is so hard, right? Exiles are burdened, right? And I don't know if I went into this enough, but like they hold all the pain. They hold the trauma. They hold the memory. They hold the physical reminders. They hold it all.
And we pushed them away.
And yes, we push them away. We pretend that they don't exist. And we try to create a life where they're not impacting it, but yet they do come out in the way in the things that we believe, in some of the things that we watch, and some of the things that we feel. They come out in tastes, sounds, physical touch. Like, they hold so much information, and for us to just pretend it doesn't exist,
right?
Oh, well, bananas.
Yeah.
So that's why like they come out in these ways, and we're like very tangible, like insecure relationships, right? And getting to know that exile, getting to know the part that is so burdened, is called befriending, right? That empathy part, then getting to know, how old are they? When did they first show up? What do they want me to? All that whole process.
Yeah.
Is befriending.
It's not about absorbing the part back into yourself.
It's getting to know it.
Yeah.
Approaching it with curiosity.
Helping it grow with you.
If you're approaching yourself with judgment, you're doing it wrong.
Right.
You need to approach yourself with curiosity.
And kindness.
And kindness, right? Like, that's so interesting. Why would I choose to do that? What was at play? What was motivating me? What was my fear?
Yeah.
Like, getting to know that part of you takes time. Journaling definitely helps just organize some of our thoughts.
Like, if you have an angry reaction to something, it's like you need to let yourself examine that anger neutrally. Because if you just get angry that you got angry, that literally does nothing. That's a complete waste of your energy.
Yeah. You're in that part.
Yeah.
You can't
You're
observe
just
yourself.
Giving in to like the most base instincts of just like, I'm not going to deal with this.
Yeah.
Yeah.
Yeah. So like looking at it from when you are in your core self and you have that approach, that intentionality, it's a little bit more approachable, So those are just some tangible ways in where we can start to play with IFS.
Which is what we do on this podcast.
Yeah, we like to play with some things. Sometimes it gets a little real, but sometimes it can be real fun.
Yeah. A little real fun.
But yeah, it's very hard. Take your time. Your time is perfect. You might be aware of some of these parts and be like, I don't want to touch that. And you don't have to.
Yeah.
That's the beauty of all this. It is your time.
Yourself sets the timeline.
Absolutely. I'm really glad that we finally did talk about this so that
we can reference it.
We can reference
everything
it.
else.
Yeah. It's such an important, I've been very grateful for IFS in my life and how it's enriched my therapy practice. Like I said, it's not the only thing I use by any means. But I have found that for many clients, it's a nice place to start, both because I'm getting to know them as a person and also to understand these parts of them. What's at play? Who's at play?
It's a very interesting snapshot of like kind of how they feel about different aspects of themselves that you could not get access to with just questions.
Yeah.
For the most part.
And like I said, like when we understand, like, for example, if I'm noticing a complex system, I'm already thinking there might be a lot of trauma here. You know, I'm already thinking different approaches, additional clinicians, you know, like I'm thinking it just provides a new context, you know, and that can be really helpful.
Should we wrap up?
I think so. I mean, did you have any other final thoughts or?
No, I mean, we went in depth on this one. I would love to go in depth like this on some other like foundational psychology topics.
We can definitely do that. We can do
other
that.
Types of therapy.
Existentialism, humanistic therapies.
Good old CBT, which we've referenced, and we should make sure that we mention this for
DBT,
cognitive behavioral
ACT,
therapy, not the other thing.
EMDR.
Yeah.
I'm just naming a bunch.
Yeah.
No, there is a lot. I'd be happy to at least give a little swim in each of these, you know, play in the waters of what some of these things can mean. So that way, again, if you're working with a therapist or thinking about working with a therapist, you know what you're looking for. You know, like, oh, that actually sounds like I could benefit from that. Or actually, that's not for me at all.
Yeah, like, are they familiar with it? Like, you can get recommendations, all kinds of stuff. So it's great.
Yeah. I've noticed IFS has become more popular among like my therapy friends.
Yeah, I feel like in the last couple of years, it's like, I don't want to say become mainstream. I feel like it's definitely not mainstream, but like I have heard it in other places besides out of your mouth, which is like, cool.
I first heard it from my therapist.
Oh, that's interesting.
I know.
Pretty cool.
My grandma therapist. No,
Your therapist?
She's just my therapist. She's just my therapist.
That'd be so funny. Oh my gosh. So if you, do you have a grandma therapist? Because then your clients would have a great grandma therapist.
I guess my therapist has a grand therapist.
A great therapist.
A grandchild.
A grandchild. Yeah, right.
Because I have a client who's also a therapist who has often wondered about my therapist.
Oh my gosh, that's such
and
a
we talk
funny
about
thing.
grandma therapists and stuff like that. It's just like, who delivers the mailman's mail?
Yeah. Oh,
Another
that's
mailman.
a great question.
A lot of Jerry energy in this episode.
A lot of Jerry energy. You say that, you don't even know the guy.
No, but
oh, your Jerry.
No, he was a mailman.
Oh,
your Jerry.
My Jerry was a mailman.
Yeah.
That sounds like a Primus song. Jerry was a race car driver. One thing I wanted to say before we like really wrap up, we have an email now.
Yay!
You don't have to post on our Instagram.
Yeah.
You can just email us whenever you want. It's purplefriendspodcast@gmail.com. We're always looking at it. Send us a message. Send us something you want us to talk about on the show. Send us a question, a weird question that you want us to answer.
Emails are so easy. Why didn't we do this from day one?
Yeah, it was just like hard to get there, you know.
But we got there, y'all. We got there. We have an email. It's
purplefriendspodcast@gmail.com.
Okay, purplefriendspodcast@gmail.com.
Yeah. So if you like that, you
go
should
email
send
us.
to it. Yeah.
Please email us.
And in the meantime, until we hear from you again, I want everybody to remember to meditate, hydrate, and protect their energy before engagement.
We love y'all.
Yeah.
Take
Bye-bye.
care, Purple Friends. Purple Friends is an independent podcast produced by Vibe Therapy Services and is not a substitute for a session with a therapist. Our show art was created by Jocelyn Lang, and our theme music is Nature Nurture by The Implied Bear. Vibe Therapy is an Illinois-based private practice serving clients in person at our Wheaton office and virtually throughout the state of Illinois. We accept Blue Cross Blue Shield PPO, United Healthcare, Aetna, and Cigna Insurance. We also offer private pay rates, as well as 15-minute initial consultations. Therapy doesn't have to feel clinical. Visit vibetherapyservices.com today to see if we vibe.